Hello, everyone. Good morning. Good morning. Oh, thank you. That feels alive. Right. My name is Olu Shokumbi. I'm so many things in one body. So I can be an academic when it's time to do that. I can do this, be an anchor to an event, also a community leader, a radio presenter, so many things. But for today, I am the chair and the anchor of this event. So I just want to say thank you for coming around. It's wonderful having you here. We will have the wonderful premiere of this movie that came from a groundstanding, wonderful research. We are all here today to see this documentary movie and see the impact of it, how the African voices, and I believe the voices of other Black minority ethnic groups came out, and how we can respond to it and move forward. What are the future things we have to take from it? So to go further, I would love to invite the brain behind it all. That woman who has shown a lot of, I've not even called her name, she's walking forward. You don't even know if it's you I'm going to call. You don't know if I'm going to call Prof. Okay, so that woman who has been able to, not only use her academic prowess, but also personality in bringing communities together to bring out this wonderful research outcome we're all here to see today. Please, let's join our hands together to welcome Dr. Josephine Adekola.
So thank you so much for the wonderful introduction. And just before I read my speech I've prepared here today so I don't forget anything, I think if there's an alarm, I think there's an exit here as well to the garage. So if you hear any sound, you could use here or at the back there. So I'm so pleased to be here, and I want to thank everybody for making it here today. I know the weather has not been cooperating with us this morning, but I appreciate that we are here. We'll probably be expecting more people coming late, but thank you so much for coming here to see the launch of the film Scotland African Voices, COVID-19 Vaccine Debate. Now, the film we're about to watch is in response to some of the questions that we've had from the communities in the two previous research we've had within the community. We had the first one last year and the second one earlier this year. And at the time, we didn't have response for people. And we did promise that we're going to come back with a response. So I knew we had to put together a project, a team, to try to respond to some of the concerns and some of the questions people have had regarding COVID-19 and COVID-19 vaccines. Now, so the film we're about to also watch represents the work of so many colleagues across many academic institutions across the world, from the shores of Africa, University of Ilorin, Nigeria, to United States of America, the University of California, to London, our prestigious university, University of Oxford, University College London, and to our very own Glasgow here, University of Glasgow, and working with our MRC Viral Center and also the Gujito Research Center. We have some of our colleagues over here who will be joining the discussion panel afterwards. So I hope that this movie will become an educational tool, because what we try to achieve with the film is to get different stakeholders to speak to each other, because there seems to be a gap in communication. Different people having different views but not really communicating with each other. So we're hoping this will be an educational tool for different groups of people to use to speak to one another. But also, we are hoping that the film will become a kind of stamp in history to reflect some of the challenges we've gone through over the last 2 years as a community and also as a society. And I want to use this opportunity to thank all our funders and all our participants, particularly our funders have been the University of Glasgow and the UKRI, IAA, and the Vaccine Knowledge Group, the Knowledge Lab, the European Research Council and the European Commission. So I want to thank them for funding this particular project. And also to thank all our participants, Professor Sarah Gilbert and the Vaccine Knowledge Group in Oxford, Actually, the Vaccine Knowledge Group got 3 of their colleagues to work on some of the questions that were answered here. So they did spend a lot of resources to help us get to where we are today. To thank Professor Emma Thompson. She can't be here today. She's in Germany at the moment. And for her time. Also to thank Professor Mona Simeon. We're going to be listening to her today from the Gogito Research Center that supported our research project in so many ways. And to thank Dr. Dimeji Bolariwa from the University of Ilorin, Nigeria. Of course, he's not here as well, but he's eagerly looking forward to see the film. And our professor, Professor Duncan Pritchard, our distinguished professor of philosophy, he was here with us in Edinburgh before he moved out to California, and we're looking to work with him going forward. To also thank Professor Ilan Kalman from the University College London, the Institute of Risk and Disaster Risk Reduction, and to our Public Health Scotland colleague who have been part of this journey. They've been part of the event in Glasgow, in Edinburgh. I want to thank Dr. Claire Cameron, Dr. Harry Prempeh, Susan Gibson, who is also here with us today. To thank our colleagues from the Scottish Government for helping to organize our interview with Professor Jason Leach. Thank you so much for that. And also to our wonderful community groups that have helped to facilitate and organize some of the discussion we're going to be seeing today. And also the Fountain of Living Water, RCCG in Air. And also, finally, I want to use this opportunity to thank our wonderful filmmaker, Danny Films, he's at the back there, for his dedication, his commitment, his patience throughout the whole process. I didn't realize how difficult it is to make a film until this whole process. So thank you so much, Danny. And I also want to finish by thanking my husband for his patience, his continuous support. He's also here in the crowd, and he'll be joining the discussion panel. And to thank my 2 children for all their patience, support during the production of the film. So the film is not perfect, but I hope that it will be useful and valuable to different groups in different ways. So thank you so much for coming, and thank you for being here.
She forgot to thank me. But I'm happy she thanked her husband and the kids. Right, so we're going to have just about 3 more welcome speech, and that will be 1 from the community groups, and 1 from the National Clinical Director, but the Deputy National Clinical Director, and then 1 from Public Health Scotland. So without wasting much of our time, I would love to call on Dr. Thelma Oke-Adibe, who will give us a welcome speech on behalf of the community groups. Dr. Adibe.
Thank you so much, Dr. Shokunbi, and thank you everyone for coming here today. It's actually lovely seeing all the community groups represented here. So my name is Dr. Thelma Oke-Adibe, and I'm the founder of Jesru Consultancy, and I'm also a lecturer at the Glasgow Caledonian University, and I do a lot of community work. I'm here to just thank members of the community groups. It's good to see lots of them all the way from Aberdeen, Edinburgh, and Glasgow. Thank you all so much for coming. Very particularly, I would like to thank organizations Prospect Hub TIC all the way from Edinburgh, Be United all the way from Edinburgh. They are here with 3 of their trustees. Give it up for Be United. I've also got Sharpen Her African Women's Network, over 5 individuals from that organization. Thank you so much, Sharpen Her. I've got representation from Safety Awareness Glasgow, Shiloh Community Wellbeing Support, Black Professional Scotland, the Play Centre. I've got the CEO for the Play Centre, Adekemi Giwa. Give it up for her. I've got individuals from Cora, from Afric Alba, and I've also got from Cora Foundation. Thank you so much, Malcolm. You've been a supporting organization, has been supporting community groups, and we see all your work, and we want to say thank you. Once again, thank you all so much for coming here today, and I hope you enjoy this session. Thank you.
Okay, so now, I always love it when people start giving me suspense when they move from one seat to another seat, hoping that, I'm the next is going to go. Anyways, I would love us to welcome to the stage now for his welcome speech, the Deputy National Clinical Director for Scotland, Dr. John Hayden.
I'm moving to the lectern because I've got a speech prepared for me and I dare not digress. So, good morning everyone, it's really nice to be here. Thank you very much to Josephine for introducing me and inviting me here today, and that's Dr. Shukumbi for chairing today's event. And thanks to those that have participated and produced the documentary. I'm really looking forward to it, not least because I'm currently doing a Masters in Public Health, and this week happened to be the week that we were studying health inequalities. So I'm really looking forward to this week. Just to introduce myself, I'm not Jason Leach. You might have noticed. I'm not as loud and not as shouty. I'm his deputy, so I'm the one that does all the work. I'm also one of the senior clinicians in Scottish Government. I've been involved in the pandemic since the very start, supporting many different areas. For example, I was involved in the shielding work. I'm still involved in long COVID, but I'm also still a practicing doctor. I get out into the real world of the NHS, and I was in my A&E department yesterday dealing with the woes of the population firsthand. But it's a real privilege to be here today, and it's great to see a lot of community representation too, as we've just heard. I know this will be a busy time for lots of you, so I really appreciate you all making the time. Having community representation here and engagement really brings value to these events. Jason, as I said, is the National Clinical Director, and he was interviewed by Josephine as part of this documentary. I know he would be really keen to have been here today, but unfortunately can't be. He's really looking forward to seeing the documentary, and he has asked me to pass on his best wishes to everyone who's been involved and for the benefit from this. I'm also familiar with Josephine's research conducted with BEMIS that was launched at the end of August, and I think Ms Todd, the Minister for Public Health, Women's Health and Sport, attended that event. The insights gathered have been shared with the health boards and have informed the work going on right now as part of the winter vaccination programme. Knowing the extent to which that information can make a difference to our delivery should make all involved with both these projects very proud. I think it's important to reflect back over the past few years, dare we go there, on what we have achieved through the COVID vaccination programme. To think how far we've come since December 2020, when the first arm was jabbed, is truly unbelievable. Since then, over 13 million doses have been administered in Scotland, with uptake of 2 doses standing at 86% in the over 12 population. With the current winter programme now in full flow, I'm under no illusion as to how much hard work lies behind those high uptake figures. Such success attests to the strength of our NHS, our community, faith and third sector groups and other key partners. The reach of the COVID vaccination programme shows that what awesome potential we have as a society when we work together. The ultimate goal of the COVID-19 vaccination programme has always been to prevent severe illness and death associated with this horrible virus. We have risen to this challenge with the World Health Organisation reporting that vaccination in Scotland prevented over 27,000 deaths from COVID between December 2020 and December 21. Partnership working has been a cornerstone of this success. Another figure that stuck out to me was that as of April 2022, the Red Cross volunteers alone had contributed 58,000 hours of work to the vaccination programme, and that's just astounding. Groups like the Ethnic Minority National Resilience Framework facilitated by BEMIS have been instrumental in ensuring we get feedback from the communities we aim to reach. And building on this feedback, on what works for you, we've used a wide range of trusted local venues such as mosques, gurdwaras, African and Polish churches as our clinics. We cannot be complacent, however. We know uptake levels vary across society, and our priority is ensuring that everyone in Scotland has the opportunity to come forward for vaccination. We also understand that as the peak of the pandemic has passed, fingers crossed, there may be some who previously came forward for vaccination but will not now. Our engagement tells us that certain groups still face additional barriers to vaccination. These barriers can range from the lack of a wheelchair ramp at a local clinic, inability to understand the blue letter through the letterbox, or a domestic situation preventing someone from attending their appointment. Putting inclusion at the forefront of our vaccination services means recognising, understanding and tackling these barriers to make sure no one is left behind. These barriers are also often not unique to vaccination, but play out across engagement with health services more generally. I've been learning about this week. That's part of my course this week. It was really good. By addressing those barriers, we can break the cycles of inequality they cause. In November 2021, we started to collect ethnicity data through the vaccinating programme for the first time. This stems from a recommendation from the expert reference group on COVID-19 and ethnicity. We've since matched 4.2 million records across several vaccination programmes. This has greatly improved our understanding of where vaccine equity exists. So, for example, Public Health Scotland ethnicity data from May shows that the uptake rates for Caribbean and black individuals for the second dose of the vaccine among those aged over 12 was 62%, compared to 86% for white Scottish. These figures can only take us so far, however. The inequalities that cause lower uptake are numerous and complex. It's projects like the one we're about to see from Josephine's team which will give us the fuller understanding of what lies behind those raw numbers. Whether it's access to services, trust in public information, or other systemic issues, we know communities have distinct needs and priorities, and an inclusive vaccination service needs to respond to that. We also know that the burden of the pandemic has not landed evenly across society. Systemic inequalities have meant certain communities have been more exposed to negative health and financial consequences. Vaccines are a relatively simple health intervention that can make a huge difference, preventing the negative health outcomes which perpetuate existing inequalities. The World Health Organization has stated that the two public health interventions with the greatest impact on the world's health are clean water and vaccines. As I mentioned, forums like this are invaluable for informing our inclusive approach. This is all the more important as planning is taking place right now on what we want our future vaccination service to look like. The guys are in the room today. This is a chance for us to ensure the successes and lessons learned from the COVID-19 vaccination service are applied to all vaccination services. At the heart of this, we must ensure that we are person-centred and inclusive, meaning we build a service that works for everyone in Scotland. I'm really excited to have an opportunity to apply insights like those we'll hear today to how we structure this important public service. So I'll end by saying once again thank you to the organisers for inviting me along here today. Thank you. And thank you to all the attendees who have braved the weather and turning out today. And I know it's causing havoc out there, so thanks for turning up. I'm really looking forward to both seeing the documentary and hopefully being able to help by answering some of your questions afterwards. Thank you very much.
Thank you, John. Okay, since John has moved here, I've moved also. So we will be going to the panel discussion now. And I will be inviting my panelists up on the stage. So if you have your questions, get them ready. I will have people going around to bring the mic to you once I point you out as the person to ask the question. Please allow my panelists to talk, okay? I don't want us to have the BBC question time situation, okay? Let's just have it cool enough, okay? Right, so I'll start by calling up first a professor of philosophy from Cogito Epistemology Research Centre, University of Glasgow, Professor Mona Simeon. Please let's clap for her as she comes up. You're welcome. Okay, and the next person I will call, I'll say the newest postgraduate student of public health, and he also doubles as the Deputy National Clinical Director in the person of Dr. John Hayden. Okay, that's him coming, that's John coming. Okay, so the next person I will call in now is a senior lecturer from York St. John's University and community representative, Dr. Olalekan Adekola. Thank you very much, sir. And the vaccination program lead for Public Health Scotland, and the person of Dr. Claire Cameron. You're welcome. And also the chair in epistemology, that's Cogito Epistemology Research Centre, the University of Glasgow, Professor Christopher Kelp. And also, one of the community leaders from the African community, especially in Glasgow, Edinburgh, major cities, Mr. Bertrus, I don't know if I'm going to, I need to pronounce that surname right, because I don't want him to hold me accountable to that. So Mr. Bertrus Echu. Yeah, I know you're being put on the spot, but I know you are man enough for it. Thank you. Okay, finally, no, not finally. Okay, finally, I want to welcome onto the panel as well, Dr. Oluwole Shokunbi, my personal self. Thank you. Right, we are here, and we're going to start this discussion majorly about the documentary we just watched there, which is, I think, has blown out so many things. Some questions have been answered, but where I want us to start first is to get the perception of those wonderful people we have up here with me. And I would like to start first with Dr. Cameron. Why am I starting with Dr. Cameron is because Public Health Scotland has been out there doing a lot in the past 2 years. I mean, they've been out a lot, doing a lot, and we must appreciate you for what you've been doing and what you're still doing. But watching that documentary, just to start, what are your perceptions about this?
Well, I'm really delighted to be here today. I was really looking forward to coming, and I've absolutely not been disappointed. Many congratulations to Dr. Adekola and the team. It's a really fantastic film, and I think what it demonstrates is that it is the voice of the community in their own words that is most important, and I think that comes over really, really strongly in the film. It is really enabling that voice to come over and really enabling Public Health Scotland to try and do an even better job of what we try to do, and that is trying to hear communities and try to support them to protect their own communities. So thank you very much.
Great, thank you very much for that. So, it's good we started with Public Health Scotland. So I want to now go to, the person we can call as the representative of the Scottish Government here. That's John, to hear of John's own perspective, just about, what you've seen in that documentary today, and, I'll say, what do you think the perspective is for you from what you've seen?
So again, thank you very much, and absolute privilege to be able to sit and watch the documentary. The power of it was just phenomenal. Claire stole all my good bits already, but I think the thing that came across for me was just the testimonies of the impact of coronavirus in the different individuals representing the different communities. That was just so powerful that the student from Glasgow highlighted how it took away her individual identity. The difficulties in accessing simple things because of the lockdown, the loss of social contact was just powerful. I think the other thing that I've taken away from it, though, is the importance of trust. Trust in what people are hearing, but also trust in the people who are delivering that message. And for me, that's the biggest learning, is about how do we build that trust? How do we foster those relationships to ensure that we are actively listening, that we're actively working together? And I said it in my speech earlier, that so that we actually make it better for the future, that we actually can achieve what we are trying to do for everybody. So thank you very much, Josephine, for this. It's phenomenal. It's brilliant.
Thank you very much, John. I'll just move straight on to Dr. Adekola. Yeah, what's your perception of this, of what you've seen? I mean, we watched that for like 65 minutes, and I didn't even yawn. I was just like, what? My eyes kept opening wider and wider. What's your perception?
Yeah, thank you very much. I also do think it's a phenomenal documentary, and commend those that contributed to it. I think I agree. One of the first things that taught me is also the concept of trust. But beyond that, is recognizing the power of people's narratives, that when we're listening to people, and you can see it's an heterogeneous community as well, so not to assume that the African community is quite homogeneous, it's quite heterogeneous, and then listening to the different groups, seeing the different perspectives and the different needs of different groups, even within that community, I think sort of came up strongly. And also the idea of trust, but then getting me to think, how do we build that trust? How do we start engaging and building trust? We can start discussing that, but I think one of the key things I will highlight is the need to engage with those communities at the onset, at the start, and not just maybe in the middle of finding solutions. So constant engagement. And it should also be sort of a form of mutual engagement as well. But I think the key thing that stood out is that idea of being able to listen to people and the power in people's narratives and the difference that it can make.
Thank you very much for that. So at that point, I think I'll go to the great philosophers in the house. They can help us with the perspective, because now we've heard from the Public Health Scotland, the Scottish Government, community representative, one of them, because I know Mr. Bertus is here. But let's hear from Mona. What's your philosophy of, I don't want to say philosophy now. What's your perspective? No, what perspective are you getting from this? Because I know you're still processing it all together.
Thank you so much, and thank you for having us. And in general, thank you to Josephine for all the work and for getting us involved in this. So what we study in our research center is trust. How to generate, what it is, first of all, how to generate it, and in particular how it relates to trustworthiness, because ideally we don't want to just trust anybody, we want to generate rational trust in trustworthy entities, right? So we don't just want the community to trust whatever they're being told, we want the community to only trust trustworthy messages, and indeed so that's one side of the story. The other side is we want them to, to avoid trusting untrustworthy information that they get, right? And for that, you might think, well, but is that on the shoulders of the community to learn who to trust and who not to trust? And what we find in our research is that that's not the case. It is on the shoulders of the policymakers to understand what being trustworthy for a particular community means and be that. Because one thing that we find in our research is that policymakers tend to fail to distinguish between mere reliability and trustworthiness. A particular chef at the restaurant, maybe the most reliable chef in the world, maybe he never does anything wrong, he makes the best sunny-side-up eggs all the time. But if I had reason to believe otherwise, because my entire community tells me that this chef makes horrible sunny-side-up eggs, that chef is not trustworthy for me, even if he's the most reliable chef. So what policymakers and industry partners need to learn is that what it is to be trustworthy is a contextual matter of fact. It's not just being reliable, being good at what you do. Depends on particular context, how you need to present yourself to a particular community in order to inspire not just trust, but rational trust. We want these people to be right to trust Public Health Scotland, not to trust them blindly, right? Because we want it to be the case that when they shouldn't be trusted, they don't, right? So I think that learning more how to communicate science in a way that inspires trust via, this contextual variation in the way in which we address different communities, I think that's something that lies on the shoulders of us as researchers of trust and of the policymakers.
Thank you very much for that. Chris, do you have anything to add?
Well, yes. First, I also want to say congratulations to the entire team on a really fantastic project. I feel like I learned a lot myself. In particular that, there are actually these sort of issues that we think about in a kind of academic setting, maybe from the so-called ivory tower of the philosopher, are actually really very real, are thought about by, people working on vaccines and people, in communities and so on. One thing that I think is particularly interesting from a philosophical point of view is kind of also the relation between information and trust. So as Mona said, when we invest our trust in someone, things can go well or things can fail to go well. Usually when we invest our trust in somebody who's trustworthy, right, then something good's happening. And when we invest our trust in somebody who isn't trustworthy, then something bad's happening. Not terrible, but something isn't going as it should be. And now, one great thing about living in this day and age is that we have a lot of information available very easily, right? You want to know where the next cafe is, you just type it into Google. On the downside, on certain topics, especially things like vaccine safety and so on, we have so much information and it's conflicting, right? And so as soon as there's a lot of conflicting information, we can already be certain that not all the sources are going to be trustworthy. Because if they were all trustworthy, right, then they would all say the same thing, right? And so there's a real question as to how we can, make it so that the trustworthy information gets taken up, and the untrustworthy information is ideally, gets less and less widespread. And I think one reason why this is particularly important for something like COVID vaccines is that here, basically, the natural reaction to this kind of variety of conflicting information is to just stay put and do nothing, right? Basically, what our task is to get people to get out of their seats, of their homes, and go and get the vaccine, right? And basically, if all you know is, well, some people say get it, other people say don't get it. They're all trustworthy to some extent from as far as I can see. Then the natural thing to do is to just stay put. Sort of, why invest the effort to go out of your house until you've sort of resolved this issue with more clarity? And I think there's a specific challenge there to get people in a situation where they feel that the thing that they want to do is get out of their house and get the vaccine. And for that, it is really so important that we get those trustworthy sources of information in touch with people and to get people to trust them.
Right, thank you very much for that comprehensive one. So, already we're having a theme coming out there. I'm a qualitative researcher, so I'm working out of the themes already. So, before I go to Mr. Burgess first, I think there's one important question I know is coming from the audience. So if I can call on Bishop Francis Alao, he's here. Oh, okay, you need the mic, sorry. That's him over there. We'll just have him ask his question, and then I'll call on some of members of the panel to answer. Yeah, let's go, please.
Thank you very much for having me. I would like to start by commending the organizers of this forum. I'm particularly blessed to be here today. I just want to make a quick point, then ask a question, if that's okay. My point is that watching this documentary, I put it in 3 strands. Forgive my layman's analysis because we have experts in the house. The first strand is socio-economic implication of COVID. The second strand is socio-political implication. And the third one for me is the socio-religious implication. But from the respondents of the research, they were emphasizing on the social-religious. And as a minister serving in the faith community and the wider community, we became the usual suspects. That we were the one influencing people, working against the effort of the government not to take the, to some extent, that happened. But I want to urge the organizers, the policymakers, and other stakeholders, going forward, please look at these 3 strands and see how they are interwoven, because trust has been coming out strongly from the podium here now. To me, trust falls under the socio-political, because the lack of trust in the system. Yes. But the socio-economic implication is also affected. Look at the respondents. They could not work. They don't have access to public funds. So the impact of COVID tends to be more on such people than other people in the community. If all these, the first 2 strands are taken care of, the social-religious, it doesn't matter what we tell them as ministers, they will still go and do the right thing. So then my question now is, COVID brought to the fore some dynamics of what's happening in our society. One of them is dichotomy of it affected the ethnic minority community more than the indigenous community. So please, my question is, what are you going to do moving forward to look into that dichotomy? Although some people are saying, no, there is no evidence to show that. Some people say, no, it happened. But please, can you do further research to see whether it's because there's an African balance that if a little child falls, if it trips and falls, it quickly gets up, it looks forward and keeps running. But when an adult trips and falls, it gets up, it looks backward to see what made me to trip and fall here because of other people. COVID has come and gone, we hope so. But this dichotomy, if something else comes, how do we deal with it within African community? Is it what we eat, or the lifestyle we live, or government's attitude toward the community? Maybe we can look into that. That will have to avert a repeat of that. Thank you.
From what I've heard there, I think the question you've asked is, what will the stakeholders, the government, and even researchers do about the division in the society, looking at the African and Caribbean society here in Scotland, what the government and stakeholders would do as a response to that of our experience of COVID-19. Okay, good. So, the first person I will call on maybe will be John. It will be John, because we started from the government's perspective to this. What are you going to do about this, John?
So the first thing I'm going to declare is that I'm not the government. I work for.
That's true. You work for the government. That's absolutely correct.
The second thing I'm going to highlight is that I'm an advisor to the government.
To the government.
I'm not one of the decision makers. So my political individual who make the decisions. As Jason highlighted in the video, we advise, they decide. So I think the key thing for me is that we need to take on board the opportunity that COVID has given us of
blanketly exposing the extent, much more than probably we have ever been thrown in our face previously, that health inequalities and inequalities in society are causing. Okay? We've had, and this is coming from my personal learning this week, is that we have been told for years now through multiple reviews, back with the Black Report, most recently with Marmot's review, of the extent of health inequalities and inequality in our system. But COVID has actually rubbed our faces in it. And we need to be mindful of that. You're absolutely right. We need to stop and look back at what we've learned during the COVID pandemic. We need to actually take our time to unpick the different strands and see what it is. You're right, the documentary did focus on the social side, but it didn't address some of the other areas. It's not a failing. It's right to do that, because when it comes to vaccination, then quite often it's the social aspects that are causing very much most of the barriers. But we need to be mindful of the wider picture, the economic landscape, the employment landscape, the opportunities that are available to people out there. So we need to actually be much more aware. And actually, part of my job is to feed into the population health team within Scottish Government, and we are actively focusing just now on recognising that life expectancy and healthy life expectancy is paused across everywhere, and it's worse in different communities. So we need to understand and take the time to understand what's driving that, what the factors are that we can make influence on at a governmental level, what factors we can influence at a more regional, local, community level, and then support those changes to happen. Okay? So there's a lot that needs to be done, there's a lot that is being done. If I take the vaccine programme, for example, there's active engagement with the communities to understand what the barriers are to being able to go get your vaccine. If you can imagine, that's being replicated across lots of different areas of government just now, as we try to strive to make sure that we're addressing some of these problems. It's not easy. It's in fact, it's extremely difficult, and it's just got even harder, and this isn't a political statement, this is just fact, because we're skint. Okay? The country is not getting enough money at the moment. Okay? So that's just made it even harder. And I think we need to then think outside the box a bit more. How can we use our resources better and target those resources to give us the best benefit for as many people as possible from all communities, from all sections of society, and make sure that we're actually doing the best we can for those different areas. It's a work in progress, I think is what I'll say, but I think COVID, we should jump on the opportunity of COVID because it's rubbed our faces and the inequalities that exist in our society.
And I must make that quick correction, actually. John is an advisor to the Scottish Government. That's true. That's true. So, I'm going to come to Mr. Bertrus now on this, because there's a question that has come now from your community about this. Do you feel the same sentiment to this question? And if you feel so, what do you think the agencies here, like the Public Health Scotland, like the advisors to government, what should they be doing on this?
Thank you. First, I want to thank the organizer of this documentary. I think it's a wonderful documentary. There's nothing new in it. It was just a bubble that was just waiting to burst. There's nothing new there. As a great psychologist, Maslow, we talk about trust. For people to trust a system, their basic needs must be met. They must feel part and parcel of that system. These people don't feel like that. So there's nothing new. So many studies, sources, we can go on and on and on. I think we need to cut to the chase and we go straight to the issues. We have seen the correlation between inequality and health. It's not a big science. Lack of opportunity in this community. This is one of the most skilled communities in UK or in Scotland. How do you link skill and unemployment? How do you link that? So it's failure in policy. We need to look at it critically and address that. How do you have one of the skilled community in Scotland, yet the most deprived community? They have the qualification in these countries, in the best universities in these countries, but yet they can't get those opportunities. So those are the fundamentals that we need to look at. And that's what is causing this mistrust. So the issue of unemployment, the issue of lack of support for African and Caribbean businesses, even in terms of help, access to help, in terms of how the information is being, the message is the communication. So these are the things that we need to look at. And how do you look at it? It has to be co-production, it has to be co-design. It can't just be top-down. The approach of service user has gone. It has to be co-design. You need to work with this community. This community has to have an input in terms of how the services are shaped and designed. And this is how we are going to have better outcomes. If not, then we are just going to be wasting our time and wasting resources. We are not numbers. We are part of the community, and we have the infrastructure to work with yourself to make this type of outcome that we want to see. So this is just the key. Lack of opportunity, and this particular community lives in one of the most deprived areas in Scotland. I heard you talking about the economics. Of course, even in terms of the best economic situation that we're in, but this is one of still the most deprived community. The very skilled community. So something is wrong. We need to look more in terms of access to employment. How do we get our people as board members in some of the board that we have so that they can influence those decisions and also contribute in terms of the insight of the community needs? I think with this, then we can then move forward.
Okay. I can hear people whispering my name from there, on that side of the room. And yes, I'll get to everyone coming. Now, this is getting on well, for me, because it's getting more interesting. Because I think I was looking at the health perspective before, the inequality in health. Yeah, I know we've been talking about social economy, but that's been brought now to the forefront. Right. Dr. Cameron, just looking at the question that set the tone for this. COVID-19, the pandemic, blew out these inequalities that we all knew was there in the first place. But from your own area of it, dealing with it now, how do you think we can now influence things going forward? Because I know, yes, you have plans for the multiple boosters now to go on. And from what we've heard is that, looking at the figures, 47% take up in this community. The first time it was 62, but we were thinking the second time it would get better, but no, by the third time it went down, 47. What are we doing? What just tell us?
So you're absolutely right that this pandemic, it's held up a mirror to society. There are some really massive inequalities that are absolutely unacceptable, that there's richness in communities that it is unable to come to the fore. And we're hearing that frustration coming out just now. I think in terms of immunisation, we're absolutely recognising what's been spoken about in terms of the voices need to come from within communities themselves. We already work with communities, we already seek to enable communities. We work, for example, with EMIS and the Scottish Refugee Council to produce, well, first of all, to understand people's needs, and then to produce information that meets those needs. But clearly we need to be doing that better, and that is why an event today is so important. It's so important for us to hear these voices so we can do that job better. Because inequalities and trying to recognise and address and change those inequalities, that is right at the heart of public health. And we'll continue to look at inequalities, including ethnicity, in the immunisation programmes, because it's so important to look at not just the headline uptake, but inequalities within that. Because we're all trying to achieve the same thing in the end. We're wanting people to stay safe, we're wanting people to stay well, and it's how we can all work best together to achieve that.
Okay, so I'm just going to ask a follow-up on that, and it's just something you said, because I know you mentioned two big organizations we have in this community, like Panelist, like the Refugee Council. But when, and that took me back straight into the documentary where we had that woman who had a smaller organization and talking about how they've reached into the, maybe, I don't know if it was the council, she said. So how are you trying to reach out to other smaller organizations which are actually even more representative of the, how will I say now, the uniqueness of this different African and Caribbean, pocket of different ethnicity in it? Because I just have to make this point, some people see Africa as like one country, but Africa is made up of 54 countries. And in those 54 countries, we even have different nationalities. Even before saying, okay, maybe ethnicity, I'm just trying to qualify the ethnicities now as nationalities. So how is Public Health Scotland trying to, get to all the smaller pockets of organizations?
Well, that's precisely what we're learning from events like this and documentaries like this, that we really recognise that these communities are massive, they are very diverse, there are many different views, there's great richness in these communities, and there's a lot that we can learn from many, many different people within them. And I think what has been really fantastic about the process in this documentary is that the documentary, it's a fantastic film, but it's not the end of that process. It's a starting point for us to be able to improve things and to be able to capture that richness and to address a greater variety of needs that are being expressed.
Great, thank you. Right, I'll call on, this light. I can't see any of you. I can only see everybody here. Okay, but I'm trying to make sure with the voices. I'm trying to recognize the names. So I think I can hear the voice of Margaret. Oh, she just said yes. Okay, right. So let's hear your question. Oh, a comment. Okay.
Oh, thank you very much. I would first of all want to actually congratulate Dr. Adekola and her team for the fantastic work. Could you join me, give them a round of applause, please? Thank you very much. Yeah, we may be sitting here and watching this documentary thinking that, it just took her 1 week. You don't know how much work she and the team have put into it. I want to say my name is Margaret Lance, and I'm the Health Improvement Coordinator for Waverley Care. I'm also the Vice Convener for BIMI Scotland. I am the co-chair of the Reset Network and for the African and Caribbean. Now I'm coming to John. I'm picking on you. You are the government. We all are. And that's why you're here. You're here because you've come to represent the government. So whatever is said here today, we're saying you take it back to them. There's been the issue of trust engagement. We are not hard to reach, because I believe that If you find people in the usual places and you don't see them, go to the unusual places. And you know where to get us. And I don't want to repeat what my colleagues have already said. We've been discussing this and talking about it for a very long time. From this documentary, just a bit of it, you've seen what people went through. This is a community that don't have family here. They support one another when they have issues. And when the leaders come to you to present these issues, I don't want to say you take them light, but it takes a long time. It takes a long time to respond. Somebody having an issue, you don't come and give them a questionnaire, do this, and then you go take another 3 months, 6 months, 1 year to come back to them. Please listen to us, because that's the only way you will understand us. Listen to us. This is not about you. This is for you to take our messages back, that we need to be listened to. Thank you very much.
Right, thank you very much for that, Margaret. See, the thing in this community, because I am from this community, and I've grown up, some people are here, I call them mom, and you know, that's something from the African Caribbean community. And I've grown up listening to them, and I've got to this stage now where I have to be chairing a panel to talk even about it. And that brings me to that question I'm going to now bring back to the panel, that yes, we've recognized this inequality. Yes, we have Public Health Scotland here. Yes, we have the National Clinical Advisors here to the government here. Yes, we have the researchers here. How really are we going to break this barrier? Because you mentioned something important there. You bring the questionnaire, we fill it out, and we have to wait like God knows how long for it to come back and hear a response. How can we make this even, better? The trust part, and it's not even the trust, like Mona said, the trustworthiness. How do we bring the trust to being trustworthy? What are the things we have to do? And I will start first with Dr. Adekola before I go to John after that.
Yeah, thanks. I think 2 points just going through my head. The first is some of these issues are quite complex, and maybe from experience, it's being approached from a sectoral perspective. For example, the issue of COVID is being looked at only from the health perspective, and then engagement and activities focuses only on let's get the vaccine out there and let's get people jabbed. But there are other aspects that need to be, or other departments of government, other stakeholders that need to be engaged so that the totality of the issues are appreciated very well before our policies are being designed and implemented. So for example, with COVID, you probably focus on those within the health line. But then if you recognize the complexity, you'll be looking at the refugee community, you'll be looking at people with different health challenges, you'll be looking at the different age group, the diversity of the community. And then that brings a much more multi-sectoral, holistic perspective to the way those decisions are made, and then it can help to capture those inequalities that could have been missed. I think the second point as well is the idea of stakeholder engagement, and I think which has been going on. Often stakeholder engagement is being done ad hoc, so when we need to, then we go to the community and we speak to them. Maybe sometimes, like someone said, it's just about questionnaire, which to me is not really engagement in itself. But it's how can government go about building engagement into the processes of government and into the processes of designing policies and implementing policies. So it's not just something that is done ad hoc, but it's something that is actually built into the process and into the system of the way things are done. And doing that will probably enable the voices to be heard right from the start throughout whatever policies and issues are being discussed or being solved.
If I can round that up, I mean, that's just like You're talking more about a long-term sustainable relationship. All right, ongoing. No, John, it's your turn. Go on. Please, just let me see your hands up so that I'll know who I'm coming to. But John, you can go on.
Okay, so just to kind of come back on what Mary said, I completely agree with her. Yeah, I'm here as the figurehead of the government today. It doesn't detract from the fact that I'm an advisor. I'm here as the figurehead. Whenever one of us comes here, whenever Jason comes, whenever I go, if you get Gregor, the Chief Medical Officer, coming, there's a group of people comes with us. So in the audience today, there's other members of the government who are also listening. So the messages are going to be taken back. So please let me reassure individuals in the audience that those messages are being heard. There's people out there listening to this and taking notes. Because I've got the worst memory on earth, I'm joking. I think what I would say is you hit the nail on the head. And so did yourself when you talked about co-design. Co-design is a fundamental process that the government has fully embraced and is fully embracing. We have an Office of the Chief Designer who helps us design and engage with stakeholder groups and communities at the earliest possible stage in service design. And it's done through a partnership and understanding of the needs of individual different parts of the communities, not the community, individual parts of the communities, so that we can tailor those services to be able to deliver for all in those communities and all across Scotland. So I'm an improver. So I came into government to help improve the healthcare system. That's my background. And co-design is a fundamental, co-design and co-production are fundamental aspects of how you change services, how you improve services for the better. And that use of co-design methodology, co-production methodology, stakeholder engagement works at all levels throughout service design. Whether you're dealing with a hospital, whether you're dealing with a GP practice, whether you're dealing with services for the community, be they social work, health, etc., etc. So I'm fully supportive of those type of approaches, and I know they are already being utilised in Scottish Government as we speak to try and address some of these complex, horrible, disgusting things that have been thrown in our face as a result of the COVID pandemic. And I know it's only words, but I'm actually part of that process, and I feed into that process every day because the Office of the Chief Designer sits within the Directorate, which I'm one of the leaders of. So I know it's there, I see it every day, I speak to the people every day who are running that part of the team to make sure that we're listening to voices. So my call is, if you're a group, shout from the rafters. Make us know you're there, so that we know when we come to try and help design services, we hear your voices, so that we can take cognizance of those voices and incorporate them into the service design.
Right. Okay. Whilst Beatrice will be saying something, you will just say something for 2 minutes, and then I will call on people we have to go to the audience.
Thank you. I think I want to go straight to the point in terms of how we see moving this debate forward. Let's be practical, let's be strategic, and let's be focused. This documentary that we have just watched with intervention, we're in a crisis, and we cannot just stop and look. We have to look at it. What is the way forward? The organization I work for is Next Step Initiative. Is a leading African social enterprise in Scotland, and our focus is on the African community in terms of looking at how we support the African communities into employment, business startups, making sure the African community has a voice in policy. We created since the inception of the Climate Change Act, no ethnic minority have ever received resource or support from the Scottish government with that. We created the first climate change project, which then led to the Act itself being changed as a result of the work we did. Equality was added as a target within the Climate Change Act. What that meant was that almost £40 million went into the BMA communities, creating no less than 7,000 employment, and the BMA having a voice in terms of influencing and shaping how these things work. We have also created the first national program into the heritage sector in Scotland, because this is a sector where less than 0.1% of BME people work into the heritage sector, which is really pathetic. And this is a sector, as you know, which was built on race, which is a social construct, as opposed to culture, which is what we are talking about. What we have seen there, the whole effect of what we have seen there is based on race rather than culture. I want to move from race to culture, because that race that has brought that inequality that we are seeing there, we want to talk more about culture. So through this natural program that we created, that's created almost about 100 employment into the heritage sector, with over an investment of over 1.3 million pounds over a 4-year period. And this is a new program as well coming up. So I want to challenge you guys to think about an intervention, because this community equally needs an intervention to address the type of challenges that we are seeing, rather than to just come and talk and move forward. So thank you.
Thank you very much, Mr. Bentus. I can call him Uncle Bentus as well. That's what I said earlier, that, these are things I've listened to while growing up, and I'm still listening to it, and I'm here now. So, I want to start first with, the lady in, it's outside, I don't know, Auntie, by the way. Yeah, Auntie Kenny,
Thank you very much. Thank you for this opportunity. And it's important what we have seen today, what we've learned, and how pathetic the situation was and still is. And the fact that COVID became the Pandora box that brought out all the ills of inequalities in this modern state, in this modern time, in this modern awareness, in this 21st century. Like in America, they say they put the 9th Amendment when there's a state of emergency. I am a community leader. I saw how my people suffered during COVID. I saw the ostracization from the community where they're supposed to belong. It's so interesting when you go to the city center and you see people make Glasgow. So who are these people that really make Glasgow? Is it the local Scottish people? Is it the migrants and the immigrants and the emigrants that make the people, that make Glasgow? I believe all of us together make Glasgow. And I tell people when they tell me, where are you from originally? I ask them back, where are you from originally? Because when we're tracing where we're from, none of us belong to Scotland or the United Kingdom. We all emigrated from somewhere. And there should be a law of humanity called empathy. When people have no recourse to public funds, there should be an exception to the case. And that was what COVID brought about. A lot of people suffered more from hunger than the fear of death or the fear of COVID. And number 2, information is very key. In any relationship where there's communication gap, the relationship is going south. It's important that the stakeholders, the government, the immigration, the health sector, and every other sector that makes up the government learn to communicate. We all have different languages. And permit me to say, the same way in a relationship, we all have a love language. You know what you say to your wife or your partner that make them do what you want. So in governance, in leadership, there should be a love language, if you permit me to say that. You may be speaking English truly, I may not understand it. Not because I'm deaf, but because there's something called cultural appropriation and acculturization, as Gen Z will call it. How do we bridge this gap? It is through the help of the community leaders. And that was what we saw played out. When people were not cooperating with immunizations, then the Boris Johnson administration had to ask the community leaders to come in. That is like burying the horse before the cart. Whereas it's the us that's supposed to drive the cart. we should, like when we do funding analysis, they will ask you what prompted this project. How do you know it is needed? What was the research you did to show it was needed? The time has come for every stakeholder in government and governance to go back to the drawing board. If you want to govern appropriately, then all those factors need to be put into consideration. Because it will be just like a labor loss if you're trying to do immunization or COVID eradication, but some people are still adamant that COVID will stay because they don't feel included in your program. So it's important to carry everybody along. And you can only do that when there's dialogue and there's communication. And it is different to say people make Glasgow and your laws are actually making me feel I don't matter.
Okay, thank you very much for that. So more on communication. If you can take it to the lady in red with the, is it the red hat? Yeah, she's the one, yeah.
Hello, my name is Chioma Gregory. I'm a master's degree student of social innovation at Glasgow Caledonian University. I actually came here to understand the social science issues behind the health issue of COVID-19. And I realized from the documentary that a lot of the resistance that was faced by the health practitioners was because due diligence was not done to understanding the social aspect of dealing with people, why people behave the way they do before the vaccines were rolled out. So, engaging the community in between was just like trying to curb what was already being rolled out of control. And I would say, moving forward, for every intervention plan or any health design that is to be, brought about, social scientists should be involved right from the onset. And there's not so much talk about social innovators right now, social entrepreneurs coming up on board. It's beginning to come up after COVID. But I would ask that the government put more attention to that, encourage more people who want to be social scientists, who want to be social entrepreneurs, to go right into it. A lot of people that want to be social entrepreneurs are more scared because it's not much profit-driven. They would rather want to go to the commercial world, but then what happens to social issues that are staring us in the face? And I wrote here that we kept talking about trust. For me, one of the ways that we could build trust is to use the community that the people trust already. And who are the communities that people trust already? These are the charity organizations, just like what Doc there talked about, the organization that he works with. These are people that you could use. The charity shops, the social entrepreneurs like Starbucks, all these organizations that interact with people directly down to the community. These are people that you can begin to get involved from the design of whatever program that you're designing. And I think that moving forward, if social innovation, social scientists are being encouraged or inculcated into health design, I'm not sure we're going to experience much more restrictions from moving forward from here. Thank you.
Thank you very much. Yeah, just pass it to the man right in front of you. Yeah, thank you.
Hi, my name is Elan Kajala. I'm a senior lecturer in politics at Elizabeth University. I think if we're going to talk about the key words today, I think it's trust, and so I don't want to go into that anymore. I just want to ask two quick questions, because the first one is, trust is not an issue limited to the United Kingdom. It's all over the world. There's like a black and white divide. We saw what happened in Ukraine when black students were told to form a different queue from other people, and they were told they cannot get on the train. So are there policies in place? She did a good job talking about how we can build this trust. There's some things in place to build on what we've learned in terms of developing this trust and making sure that things cascade down in the future. And then the second one is on the issue of how the statistics were used. Because one key issue was that the statistics were used in such a way that it led to further stigmatization. You know, when you hear 50%, only 40 or 50% of black people have taken the vaccine, then you go to the supermarket and they look at you as, oh, a super spreader, or they are here. So I think that is something, or, you know, if there is anything in this documentary, I love documentary. I'm working on one myself on a research, so as a researcher. So if there's one thing that we learned, it's that listening to the voices of the people at the local level. But the question is, how do we use statistics in such a way that it doesn't aggravate the problem, it doesn't lead to further stigmatization? I've gone to the supermarket where people don't, even with full mask and everything, people move away from you as if, oh, they said black people are not taking the vaccine, so they are the super spreaders. How can we use these statistics? How can we work with the media in such a way that we don't aggravate these problems? Thank you.
Okay, thank you. Yeah, we can have that. We are coming back to the panel now. So I think the questions are all interwoven. So the way I'll do it would just be like to roll out my questions to members of the panel. And I would like to start with John. I haven't listened to all of this, John. What will you tell us are the expected practical next steps for policy perspective? From everything we've heard, from the questions, what are the expected practical next steps concerning policy perspective now? Yeah.
Okay, so I think from a practical next step is that we need to be listening more, we need to be engaging more, we need to be actively seeking out individuals, groups, communities that are not the norm, that are part of discrete communities that we are not getting engagement with, we're not getting proper communication with, and we need to be using all the tools in our armoury to make sure that we are getting both the messages from the community into policy decisions and directions, but also back out to the communities about what action's actually been taken. I think we need to be much more transparent, and we are trying to be more transparent, but I think we can do much more. I think we need to actively be more effectively engaging at different levels and across the different, and joining up the different parts of government, because we know that the interplay between education and health, economy and health, social standing and health are not discrete, so that we need to make sure that the education department talks to, and Sir Michael Marmot has talked about this previously, so I know I'm on safe ground when I say this, but we need to make sure that actually happens. We don't talk about it, we actually make it happen. So for instance, during the pandemic, I spoke with education, I spoke with the economic team and the finance teams across government. I was the one who was in front of the hospitality sector discussing the impact of COVID and taking back what they saw as the impact of COVID on them. So I think we need to do more of that, because we were good at it, or better at it, not good at it, better at it during COVID than we were previously, and we now need to build on that going forwards. I think that's the practical next steps we need to do.
And would that be taking into consideration addressing poverty, building the trust, and engaging more with the community?
Yes, absolutely.
Okay, then have it. Yes. Okay, I'll go to Claire again. Claire, so for your own part, with everything that we've heard so far, the question is, what actions do you want members of the communities to take to improve vaccination and overall health well-being? I mean, and that would be, starting even from public health itself. I know you've said, communities need to come up, fine. But how better will you even do this in an inclusive way, in an open way that will make these communities come forward to you?
Well, we're going to do it together. So it's not just what I think or what Public Health Scotland thinks. It's working together, it's that co-production, and together deciding what the best thing is to do. We need to listen to each other. We're doing that just now. and then we need to plan together as well, because we've all got the same aim at the end of the day. We're all wanting as many people as possible to stay safe. We're wanting as many people as possible to stay well. So let's work together on that.
Okay. And does this mean that if any of these communities invite your office or your organization to a meeting, your community event with them, does that mean they will have your nod and consent of attendance?
What it means is we are wanting to work actively with as many people as possible. You've already heard from John, shout from the rafters. You know, we're wanting to hear these voices. We need you, you know, just like you need us.
Yeah.
So let's work together.
You said that, and that just reminded, because something that is peculiar to this community is that, and this also goes back to the socio-economic part, many work Monday to Friday. So sometimes these communities, when they organize these events, are Saturdays. And we know you are civil servants, you work for the government, sometimes you may not be available for an event on a weekend, because I know these affect many events in these communities. How can Public Health Scotland, I will come back to John too on that later on, but how can Public Health Scotland help these communities? Because we have that peculiar feature in this community. You can see here now today, if this were to be later this evening, I'm sure we'll be having to look for extra seats, because many people have finished their work for the week. So how will Public Health Scotland help bridge that gap that we have?
Well, you're talking about some practicalities now, and we can look into those later, but I think what we're offering, you've heard it from Public Health Scotland, you've heard it from Scottish Government, it's a commitment, and in the end, it's a great desire to work together to achieve the common aim that we've all got. And in the end, it's going to come from within communities themselves. You know, Public Health Scotland, Scottish Government, they're going to be enablers of that, they're going to be listeners of that, but in the end, it's going to come from within communities themselves.
Okay, so I need to go to Mona, because yes, the thing about this, and I mean, we're just about to finish up this now. Mona, you've heard everything. You are the researcher here. You're part of the research, you know, that research community here. And the question is, what do you think should change from the practitioners, from the stakeholders, from the community? And this is in terms of this behavioral perspective, when we're talking about trust and trustworthy. What should change? What should we be taking forward from here?
So the lesson that I learned today is that us researchers should do faster and more efficient communication and impact with policymakers. Because it's a bit of a shame that we know how to combat lack of trust and we know how to combat disinformation, but we don't, communicate enough with policymakers in order to efficiently, do all of these things. And that's a classic problem for researchers. And the more theoretical, the older the problem, basically. So I think that the lesson that we learned today is that we're not moving fast enough, and we're not transparent enough, and we're not communicating our research results in real time, and that has very bad practical consequences. We have the research, this shouldn't be happening. The other thing that I've learned today is that we should all work together and actually go in the community and investigate why lack of trust appears, not just discuss it theoretically in our armchairs, because there's going to be very many different reasons why this lack of trust is generated, and we don't know how to communicate or how to indeed to advise public policymakers to communicate until we know what the misleading evidence in that particular community is that's generating this lack of trust. So yes, the lesson is more engagement between researchers, the community, and the policymakers.
Thank you, Mona. Just pass it to Chris, because this one, Chris, why I need to ask you this one is because of what Bertu said earlier, in terms of the opportunities given to this community, in terms of funding for things, funding for interventions. And the question really is, in terms of research funding, the challenges that come with that and how it affects the African Caribbean community. What can be done to change this interest, to show, more fairness and more inclusivity?
Well, I mean, speaking from a philosophy perspective, I think one dimension where we can help, where our research can contribute, is by, understanding the nature of these relevant phenomena, like the nature of trust, the nature of injustice, the variety of injustices, because as we understand these things better, we will be better able to control them, like to bring about the desirable things, to prevent the undesirable things, right? I mean, so to give one example of an inequality that is quite widespread, but that has started being theorized only quite recently, is that due to our biases and so on, we tend to assign trust differentially. Right? We give certain people who appear in a certain way, maybe, more trust than we should, and other people who maybe appear in a different way, less trust than they should. Right? That's a very subtle form of injustice, right? And we have started theorizing about that in a systematic way only very recently, right? But basically, one thing that we can do as philosophers is to try and think about that, and then as Mona was saying, to try and communicate the results that we have to the people who, actually can change the world in a more practical manner. So my sort of suggestion would be indeed that, we've got to focus on the societally important phenomena where we can help understand their nature, such that once we have understood their nature better, we can feed that back in a way that will actually make a difference and help address these inequalities.
Okay, thank you very much. And I think we'll give Betches the final word to say here to them. Because I know we've heard about long-term sustainability relationship needed from Dr. Adekola already. John has accepted that that needs to happen. Same as Dr. Cameron, we've accepted that. So, as the voice of the community, what are you saying back to us as we close?
Well, I think it's an interesting debate. The conversation that we've had, I think, is very healthy. I think we need to move away from the conversation into proper action. And hopefully look forward talking to John and Claire to see how we can put some of those things into action so that we start making those differences that we want to see within our community.
Thank you very much. I mean, on that note, we have been able to get some things up here. We need to build trust. In building trust, the community, you need to come forward. They have told you, shout on top of the roof if you have to. On that note, it has been Olusokunbi here today. Thank you all for viewing this and for being part of the
Well, I think the film just goes to confirm the challenges that the African and Caribbean communities are facing across Scotland, the significant inequalities that has been existing for intergeneration within our communities. And these inequalities in terms of lack of access to opportunities, unemployment, is what has led to the type of level of impact that we are seeing. And it's very, very clear. The question is, what is the way forward? In terms of way forward, we need to continue working hard in terms of looking at how influencing policies to ensure that policies are inclusive, take into context the need, the aspiration of the African and Caribbean community across Scotland. In terms of looking at how we support business startup, in terms of employability, we at Next Step Initiatives, as you know, we created the traineeship program, and the whole aspect of the traineeship program was to provide access to employment for people within our community. Also the business startup, through our strategic partnership with Comic Relief, we supported almost 51 African and Caribbean organizations across Scotland with an investment of over £358,000, which then create employment and provide access to training. And that is key, because those are the things that we need to do. We also need to address the issue of misinformation, how we communicate, and this is important, and that's where it's important for statutory bodies like government and other agencies to work with community groups in ensuring that the messages or the messaging is reaching the community in the way that they can understand and access those services. So thank you very much.
So I'm Emma Pickin. I'm from Be United. I think the movie was really, really interesting. It's good to see things where community groups are actually being directly engaged and being spoken to, because I think so often there's a lot of times, like is mentioned in the film, where decisions are made but without the input of various people. So it was really good to see that. There's, you see a lot of documentaries and things that's always outside of Scotland, outside of the UK. So it was really nice that it was very local. And yeah, I just think everyone involved, they've done a great job with really, engaging people all across the country, also with the different experts and things. I do think I kind of likewise have a slight lack of trust in some of the information, and so I think it's good. I think it is good thing. Initiatives like this are very good to try and break some of the stigmas. I'm not sure personally if I still am fully stigma broken on the vaccine, if I'm honest, but it's really good to come and attend such things and hear different voices. One thing I do think in films like this, I felt obviously it's very much pushing the benefits of the vaccine, but I felt also, for me, I switched off a bit because I felt there was no professional voices speaking about the other side, and maybe that's the point. Maybe that's why, because they want people to take the vaccine. But for me, I felt a bit, at some point, I switched a bit off from there. So that's my my honest. Yeah, I felt it was one-sided, which I can understand, but it's Sure.
So would you recommend the film for someone to watch?
Yeah, I would actually. I think it's good just for that education, and I think it's it was really good to hear also the concerns of many of the black communities in Scotland, and I think that's really, really important to listen to people's concerns.
It was a good documentary, and it highlighted the plight of the minority ethnic community in Scotland. And I believe if the government would take this on board, it will help in future plannings, and it will enhance proper governance as well. Because for every incident, there's a need for feedback. And when you get the feedback, what do you do with it? So in this documentary, there's a lot of learning points for all stakeholders and the government being the majority stakeholder, because if they got it right with a small part of the population, which is the minority ethnic community, they will get it right with every other part. Because if you're focusing on the locals alone to get the job, the knowledge, the information about COVID, the information about getting immunized and all of that, the benefits of it, and this information is not going to the other occupants of the territory, so to speak, or other people in the population, which are the minority ethnic community, it will just be like a counterproductive. Because if every other person in the population is protected and a certain percentage is not, the certain percentage that is not protected will eventually come back to infect the ones that are immunized. So it's very important that the government take this on board and see how going forward. What are the lessons learned? The first lesson learned is that there's mistrust among the people or the minority ethnic community, and how can this trust the lack of trust be repaired? It's important that the government, the stakeholders, the public health authorities, the lawmakers work with the community leaders in this community, because they have the direct access to the people, and these are the leaders that the people trust, that they've entrusted their lives into their hands. So they become the bridge between the government and these targeted characteristics that we're talking about. So it's important for the government to have a relationship, a dialogue, a communication with the leaders in the minority ethnic community. We heard that during COVID, they were talking with Refugee Council, which is good, and they were talking with BEMIS. BEMIS does not represent all the people of colour in Scotland. Neither does Scottish Refugee Council. There are some people that are here as professionals that neither belongs to BEMIS area of catchment, nor belong to the Scottish Refugee Council's area of reach. So these are being overlooked. So there's a need to look into these other people that are not necessarily refugees, or they are not necessarily under BEMIS catchment, so that everybody is included in consultations. Then we get the positive result, the positive destinations that we all want to get to. And that is a people that is governable and a government that is listening.
Yeah, the documentary today was very reflective of our ideas, of us as a community, with the African community. And like we have all heard, it's a heterogeneous community. But there are some concepts that come up powerfully to me in the dialogue, the documentary of today. We look at the body-mind theory. We look at sources of information. And it is true that we want to achieve unity in diversity, but the issue is there is lack of information. Not really lack of information, but lack of adequate and trusted information. So it takes us back to the sources of information. And I think where the health sector, Public Health Scotland should begin from, it should begin by asking the question, who do we as a people trust to give us the right information? I think that's a starting point for them. They should go back. They should go back and start from there. Ask the people, know from the people, get the information. Because the issue here is, are they asking the right questions? And are they getting the right answers? And if they are getting the right answers, how are they using this information? So, having said that, there's the second aspect, which was not highlighted in the documentary, the aspect of choice. We're being told that 3 different types of vaccines have been approved in the UK. But now, I don't know which parameter is being used to decide who receive which vaccine. So we're not given that choice to choose whether I want Pfizer or AstraZeneca, and then Moderna comes with the whole issue of upsetting the menstrual cycle and causing other health damages, which I myself am a victim. So I think that's just what I have to say, but yeah.
I think the documentary is a very nice one. The organizers did a great job. And from the interactions, the debate, the panel debate, I think there is a connection, and a very good connection between the Scottish government, and the minority, the Beme, and also there is a consensus. The Scottish government has also, through one of the representatives, to look into the issues of the minority, a way of bridging the gap and making the minority people to be included in the policy making and every other benefits, in the system. So it's been a debate and it's been a word of the mouth, and I hope that it all gets implemented and gets into practical actions, and then we see the result of it. So I think generally it's wonderful.